Hello everyone, welcome to my channel of Decoding OBGY Residency. Here we are now starting the preterm birth series, and in this series we will discuss in detail about preterm birth, preterm labor, and what are and how you will manage this case when a case of preterm labor comes to you in your hospital. So, why it is important to know preterm birth or preterm labor? Okay, so um, preterm birth is the leading cause of neonatal, perinatal mortality and morbidity, and also under 5 mortality. It is a substantial global health issue having consequences on newborn, family, and the society, and it is a prominent issue in obstetrics. From decades or from many years there has been so many trials and so many discussions going on for this preterm birth, but this remains a issue till now. Okay, and it also causes a significant loss of economy as it is expensive to take care of preterm babies. In it also increases burden on the healthcare workers, hospitals, and increase the NICU admission rate. A lot of manpower is required for the care of the preterm babies, and preterm babies has both short term complications and also it has long term complications. Then what is the incidence of preterm labor? Now the preterm labor incidence is around 5 to 15%, but the incidence of preterm labor is increasing. So why it is increasing? Because of the elective termination of high risk pregnancy before term. A lot of women are of high risk category, they are getting pregnant, and their termination of pregnancy is done electively before term, again due to various complications of pregnancy like preeclampsia, oligohydramnios, and IUGR. Elective termination of pregnancy is done before term. Okay, and also there is increased rate of multiple pregnancy, increased use of ART techniques, and increased use of antepartum fetal surveillance, increased use of Doppler leading to early Doppler changes during the ANC period, and their elective termination before term. Okay, and also there is a look a better availability of neonatal services, and which decreases the stillbirth rate and increases the neonatal survival, but does not reduce the preterm birth rate. Okay, and better neonatal services are available. Because of that, we are we are doing interventions in these high risk pregnancies, as we know that for maternal indication the termination of pregnancy is to be done, but as we have better neonatal services we can terminate it and take care of the preterm baby post delivery. Okay, so these are the various causes for which the incidence of preterm birth are now increasing. let's Let us talk about various definitions of preterm birth. Okay, so in preterm birth we have preterm birth, preterm labor, and threatened preterm. Preterm birth is the birth between the age of viability and before completed 37 weeks. Preterm labor is the onset of labor, that is regular painful uterine contractions, which is associated with progressive cervical changes, that is dilatation and effacement, before completed 37 weeks and after the period of viability. So it is the regular painful uterine contraction associated with progressive cervical changes. The term progressive uh, you should remember, because the progressive changes in the cervix, that we will diagnose it as preterm labor. If there is no progressive changes or the cervix remain just 1 centimeter dilated, then it is known as threatened preterm. When there is no progression of the cervical changes, it is known as threatened preterm, and when there is cervical changes, then it is called as preterm labor. Okay, the presence of uterine contractions and cervical changes leads to preterm labor. What is threatened preterm? It is the presence of only uterine contraction with no evidence of progressive cervical changes before 37 weeks. Okay, then we are discussing that preterm labor is between the period of viability and before the 37 completed weeks. So what is the threshold of viability? So threshold of viability, it is the lower limit of fetal maturation which is compatible with extrauterine survival. According to WHO, the threshold of viability is 22 weeks. In UK it is 24 weeks. In India it is 26 weeks. Earlier it was 28 weeks. So in the developed countries, they are having better neonatal or advanced neonatal services. So there the threshold of viability is lower, around 20 to 24 weeks. Okay, and according to birth weight, more than equal to 500 gram fetuses are included under preterm birth statistics. Okay, next category of the preterm. According to gestational age, the uh, preterm birth is classified into 4 different categories. First is the extreme preterm, which is less than 28 weeks, and then very preterm from 28 to 32 weeks, moderate preterm from 32 to 34 weeks, late preterm from 34 to 36 weeks. Okay, next, types of preterm. Types of preterm. So preterm birth, it can be spontaneous preterm birth or iatrogenic preterm birth. Iatrogenic preterm birth, where we terminate the pregnancy before term either due to maternal indication or due to fetal indication. Okay, then spontaneous preterm birth. Spontaneous preterm birth occurs as a result of spontaneous preterm labor, and spontaneous preterm labor can occur either with intact membranes or it can be due to preterm premature rupture of membrane. So for now we will discuss up till now. This is a introduction video for the preterm labor series, and after that in further classes or in further videos we will discuss a lot more about preterm labor. Thank you.